have been actually for several weeks, making sure we have the facilities available to be able to take care of these patients who may have COVID-19. We have never forced a nursing facility to take care of COVID positive patients if they did not feel that they had the capability to do so. And I do think that the work we're moving forward with now will help us even more so to protect nursing facility residents.
She believes that this will be a much more effective solution to protecting seniors in nursing homes from COVID than previously, where we had 1,957 reasons to be concerned. 1,957 deaths, 1 in 3 COVID deaths in the state of Michigan happening in nursing homes. And those numbers are actually very suspect. They are, I think, expected to go much higher, and especially once you also include assisted living centers and adult foster care. But those were federal numbers. State numbers, we think, will tell a different story. And why don't we have a more up-to-date number? Well, perhaps the man at the other end of our line could explain that to us, because he's been trying to get the answers for well over a month now. State Senator Pete Lucido from the 8th District of Michigan. Good afternoon, sir.
Good afternoon, Guy, and good afternoon, listeners all around Detroit and everywhere else here in the great state of Michigan.
And don't forget Ohio and Indiana, Pete.
Oh, wait a second. I'd be remiss to not say hello to our neighbors also. I apologize.
Yeah. So when you heard Janae Caldoon there, they feel that this very aggressive testing, this mandatory testing that they're going to have for every nursing home patient and staffer, will do the job where perhaps we didn't do as good a job as we could have earlier. What's your level of confidence that the protections that they have put in place will be enough?
You know, just testing individuals doesn't take the COVID out of the facility, which means why are we leaving them there to begin with, subjecting those that are the most vulnerable with the compromised immune systems to get the COVID? Look at, Guy, it's real simple. When the governor allowed COVID patients to be put back into the facilities, it's a mistake. It is a big mistake, and it's because we know that the death toll was escalating with the age population. I call it the greatest generation that ever lived. And I'm looking at one thing, and that's what could we have done better? What lessons did we learn? We had a facility in Wayne, the Beaumont Hospital, that closed down, laid off 4,000 workers. We could have taken COVID patients that were elderly from nursing facilities or those that were aged that caught the COVID, brought them to ground zero, I call it, at the Wayne facility of Beaumont when they closed it, went ahead and set it up because they had proper PPE there. Let me explain. PPE was being fought after and sought after by both the nursing facilities and the hospitals. And the nursing facilities were second in line to the hospitals to get the PPE. In addition, they weren't properly staffed with the right medical trained personnel to take care of people. They were more orderly to take care of seniors, to dress them, to bathe them, to take care of them in that personal style. But they didn't have the specialization of medicine and medical techniques.
Or infection control.
Yeah, well, that's the bigger thing, Guy, but there was also no medical assistance that was needed to take care of COVID patients. And then when the governor locked out the loved ones, no one knew what was going on, causing even more chaos and more death. Some of the nursing homes in my district had, upwards of 20 people dying these, and the numbers are escalating. There is a question mark, or better yet, my curiosity is piquing every day. Why is it taking so long to get numbers that are legally binding on the nursing homes to provide? Mm-hmm. What's going on? What's really going on behind the curtain, Governor?
So, I asked Dr. Caldoon about that, and I said, why would testing be a more effective remedy than just not putting these COVID patients into a possible population where this could spread? Because we already know that they, for whatever reason, didn't do as good a job isolating them, the infected from the non-infected. And she said that they believe that's what these regional hubs would do, and that LARA, Licensing and Regulation, is overseeing this to make sure that they have those infection control protocols in place and that they're following them. So are you convinced that LARA is doing a good enough job and that there's enough LARA personnel out there that are well-trained to ensure the oversight?
We had oversight committee. We had it twice with the director, Robert Gordon, and we had also LARA director there, Orlin Hawks. Both individuals state stated that, look, this is the only option or alternative they could conceive that would work. And I say, no way. We can do better. We are better people here in Michigan. Like they did in Florida, Guy, they took the COVID out of the facilities and put it into a COVID facility that would have specialized care. That would keep loved ones away from the virus, and they would protect the loved ones that had the virus by giving them around-the-clock care to get them better. Then you can test them, Guy, and make sure that they're COVID-free before bringing them back home to their nursing facility. That's what should have been done, and that's what my bill does now. It says we will not mix apples and oranges. We will make sure that the COVID patients stay away from the non-COVID patients so that infection won't spread. In addition, before they can re-enter the nursing facility, they have to be tested and cleaned from COVID to go back in. We have loved ones right now that can't even get in the facility and haven't seen their mother, their father, their uncle, their aunt, their grandma, grandpa in the last 5 months.
You will be forcing that on the Whitmer administration then legislatively. You will saying you may not place these people back into the population. So are you going to mandate that they go to a COVID ward?
Real simple. The department shall develop and operate a centralized intake facility in each of the 8 healthcare regions of this state. Why? Because it's the best practice. I have 2 doctors testifying on Thursday at 1 o'clock in the afternoon in the Health Policy Committee that's going to say this policy of putting COVID inside of a facility where you don't have the proper ventilation system, you don't have the proper PPE, you don't have the proper medical personnel. And here's the worst part, Guy. The fire marshals went in and said there's a curtain that's impeding a fire exit, which means this isn't a secure, under the governor's order, a secure way of doing it, and it is an impairment on the fire laws, and therefore we'll shut you down.
Okay.
This is ridiculous what I see going on here.
We'll await that testimony come Thursday from your committee, Senator Lucido. We sure appreciate your time, and I know you'll keep us updated, and we'll touch base on Thursday perhaps, sir.
You take care of yourself, guys.
All right. Senator Lucido, 8th District, Shelby Township.